Good afternoon, everyone. I'm excited to talk to you about the out-of-state Medicaid world. Just a little bit of background on myself. I actually was part of the hospital system for many, many years, and I was also doing the out-of-state Medicaid billing from the hospital side. So I'm excited because I get to continue to work on the out-of-state portion in my current position and just continue to really have a lot of great practices that we have had along the way. So the best thing, as Lisa has mentioned, we really need to have a really good workflow, right? You need to know exactly what are these accounts. The majority of the time, you're going to have an out-of-state patient that's coming in that sometimes they think they have Medicaid, sometimes they don't know if they have Medicaid, right? So I think the number one thing is going to be that's really, really key is to first identify, are they really truly eligible for the data service? What are the actual benefits? Because might be that they're only eligible for certain benefits. And is that payer really truly out-of-state Medicaid? There are some commercial plans that are those types of things that you can see as well too. So really the key is identifying what it is that they are eligible for and who their HMO is. That is step number one. Once you have identified that, then from my perspective is you really truly need to understand who those payers are, especially for your surrounding states. What are the timely deadlines for the enrollment side? For the claim, do you need to start an authorization? Do you need to be enrolled in order for you to be able to start the authorization, right? So being able to really truly identify those particular states are key. So one of the things that Dave talked about is the portion of maybe the eligibility team being able to also get folks enrolled with out-of-state or with in-state if that's what they need. The purposes of today's presentation is going to be specifically on people that really truly are eligible for out-of-state for the data service. So once you have your payer identified, right, what exactly are those particular requirements for that state? So there are some states that are going to require itemized statements. As I mentioned, there are some states that are going to require the authorization to be completed or the enrollment itself. There's also several HMOs out there. So that's where it's really important to understand because the HMO may not require all of those things. So again, identifying exactly who the payer is and what those requirements are. The majority of your accounts that are inpatients or anybody that comes in through emergency observations and inpatients are going to require some form of authorization. Keeping the folks that are doing your authorization in the loop is making sure that they understand that there's an inpatient account, that they are out of state so that they can start that authorization right away. The majority of the payers will allow you to start the authorization without being enrolled. You do have some payers out there that will not allow you to start that authorization unless you are enrolled, but they'll allow you to retro back once you are enrolled. The next and the funnest part of it is going to be the enrollment verification. So the states require two types of enrollments, either the MPI that you have that's listed on your claim, so on your UB. For the facility side, all of the state plans, not HMOs, but the state plans require some form of enrollment. So whoever you have listed on your UB is going to be who you have to enroll for that particular state. Unfortunately, on the 1500 side or on the professional side, it's going to be dependent on how it is that you have your claims billed. The majority of the time, you are going to have your claims billed through a group, but then there are also times that maybe you're doing it through the facility side. So with those, unfortunately, you're going to have potentially two separate enrollments. You have your UB, whoever you have listed on your MPI, and then also on your 1500, whoever you have as the billing provider may also need to be enrolled if that state requires that. So once you have identified if enrollment is required, my recommendation would be is to start that enrollment if you're really truly not enrolled, right? And we'll talk a little bit more about what enrollment means and what the tracking can be and all of that kind of stuff. But I think it's being able to separate the enrollment deadline, the authorizations deadline, and then also your claims timely deadline. So those are the key pieces that you've got to make sure that you do. In a perfect world, we're already enrolled. We are good to go. We've got our authorization. The second piece that's really key and it's very important is that the majority of the payers now only allow you to bill electronically. So setting up those EDIs directly with the payers for those particular payers need to be done. really, truly, I would say about maybe 10% of the payers allow paper today. The majority of them are going to be that you have to do that electronic billing in one way or another. So again, managing those particular payers, looking at your entire inventory, who is coming to your facilities? Are you a type of facility that people are coming in for maybe during the summer or those types of things? Or are you a type of a facility where you are going to be doing some specialty surgeries or specialty services that really truly require you to ensure that your providers, that your facility is enrolled with those particular states? So key, again, is to ensure that you have those electronic payers set up within your system, having a good process in place for that, looking at your rejections. But you've got to make sure, unfortunately, is that you've got to make sure that you are keeping up with your enrollment deadlines and also with your claim deadlines. They're not necessarily the same deadlines. You have separate deadlines. Most of them are the same. You have some payers that when it comes to the enrollment, they only allow you 45 days. So Illinois allows you 45 days from the admin date, not discharge, but from the admin date for you to be able to complete your enrollment. The claims process is different, but at least from your enrollment standpoint, 45 days is the shortest that we have so far. And then you have some payers that allow you all the way up to 1 year to be able to complete that enrollment. Once everything is perfect, you get all of your payments in place, everything is posted, you go ahead and get those returns accounts. Again, reconciliation, making sure that you've done your contractual adjustments, your charity. Some organizations may potentially still do charity if maybe the patient is eligible for the data, is not eligible for the data service, but they are eligible for Medicaid today. So a lot of, depending on who your charity or your compliance deadlines are, or your compliance situations are, you may want to look into that, right? Because if it is something where there is no propensity to pay and you're really truly trying to collect from someone that is eligible for Medicaid today, but just not on the data service, right, being able to manage that AR in that sense as well too. Now I'm going to go ahead and go to the next slide that we have, which is the enrollment piece of it. So from my perspective, being able to have a really good understanding of what the enrollments are and what the requirements are by state is key. So being able to identify some way to have those particular payers and updating the information, because the payers are continuing to make changes. So they have quite a bit of information that they're updating throughout the times. They may be updating portals, they may be updating different things. So it's just making sure that you're staying in the know of what's going on, especially for those particular payers that the majority of your clients or patients are coming from. So the biggest key that we have is, again, what exactly is needed for that particular payer and how are you able to have your representatives or your specialists identify that really truly an enrollment needs to be started right away. That is one of the things that we have is we want to make sure that we have who is the particular facility, MPI, right? Who are the providers that are listed when it comes to enrollment? If that particular state requires the facility and the physicians to be enrolled, that means that it needs to be all of the physicians that are listed on that claim. So if you have 5, 6 different physicians listed on that claim, especially for some really high dollar accounts, all of those physicians that are listed on the claim do need to be enrolled. So it's not just one physician, it's everyone that you have listed on that claim. So the other thing too that is important is going to be is when are those particular enrollments going to expire? There are some payers out there that will allow you to be able to just send in a simple form that says, yes, I want to continue to be able to be enrolled with your state. Also, there are some states that will only allow you to start an enrollment when you have a claim. So those are things that you need to be cautious about as well too. But more importantly, for your states where you have the majority of your traffic is really truly knowing when are you enrolled, when are you going to expire for that particular MPI, and then just again, make sure that you're maintaining everything as far as like knowing where to go for your updated licenses, CLIAs, those types of things. That truly is the key. And how do you then identify a way to be able to give that information to the people that are doing the day-to-day work on those accounts? If something is missed, can somebody catch it right away to ensure that there is an enrollment that is required? Let's get it to the right place so that we don't miss any of those deadlines. All right, so here is the actual enrollment tracking, right? So again, it's identifying when you're making the decision that you want to be able to participate in a particular state. So this information will be shared in the presentation, just as far as what we would require in order for us to be able to start that enrollment, right? So again, making sure that you have the right people in place. Who is your credentialing people that's doing your Medicare enrollments? They're going to have all this information, right? So W-9s, your CLIAs, DEAs, you got to ensure that you have everything that is listed on each application. What we have done and we continue to provide for our staff is making sure that there is an updated process of anything that's required. So if there's a state that's made a change where now they're requiring certain items, we'll update that tracker so that we can start that process and requesting that information right away. The other key thing when it comes to enrollment is you've got to make sure that your PACOS registration, so when you have your Medicare enrollment, that your board of directors are up to date, right? Are they really truly still there? Are they really truly still managing that process? Because it comes to the enrollment side of it, there are different payers that may validate the information that you have listed on your application from your PACOS enrollment. So if it turns out that your information is different, then at that point they may deny it and then require some additional information. There's a particular state where if that's not exact, then they will require the board of directors information along with their fingerprints and background check in order for you to be able to then move forward with that particular enrollment. So it comes to the facility side. The other question that I get a lot is, do you really truly need all of the board of directors information? And I wish I had a magic answer to that. And the answer is you absolutely do. So if they're listed on, again, your PACOS form, when it comes to the way that you registered for Medicare, if there is 10 people on as board of directors, if there's 3 or 4 as board of directors, then all of them would need to be listed on your Medicaid application as well too. So the biggest key to success here is going to be because as you can see, there's a lot of personal information that's going to be required in order for you to be able to complete this. So one is you've got to make sure that you have a good support system when it comes to the financial aspect of it, right? So how much of the amounts that you have, maybe there's one claim that's $50,000 that may have paid at a 20 or 30% reimbursement rate. But if you have one of those claims times, once a month, it may add up, right? So I think that the biggest thing is that just looking at how much of a loss it really truly is. Are you writing these off to a charity? Are these being, again, sent to bad debt, whatever the case may be, right? So in that situation is looking to see what is the true loss and what is it where you can actually take the information and be able to potentially get some revenue for this. But it's got to be with making sure that everybody is on board, that they're going to provide this information, and then having a secure way to be able to have all this information, right? The board of directors information, it's very personal, right? You're talking about their date of birth, their potentially the last 4 of their social security number. Texas in particular is also asking for the driver's license number. The same with California, home address, right? So it is a lot of personal information. So how do you keep all this information secure and only for the people that really truly need to have this information? All right. The next piece that I have is going to be on the physicians. So again, with the claims that comes from an out-of-state payer, the physicians need to be, if you have them listed on the claim, they have to be enrolled. So again, this information is going to be provided to everyone. This is just an updated list and we continue to go through and review it. New York is looking at potentially making a change to including the provider information. From my perspective is we got to make sure that we're staying up to date and making sure that there is a good process in place if it's going to affect you in any way, shape, or form. New Mexico just recently changed their portal and they were down for, originally it was going to be 60 days and then it ended up being a little bit longer. So how is that going to impact your revenue if you are not enrolled with New Mexico and you have a large claim that's listed there? So Those are all things to look for. So keeping up with this particular process. Now, in this case, all states, it's a lot, right? But at least being able to have a good hold on your surrounding states, I feel like that's at least where you can be successful. The majority of your patients are going to come from the surrounding states. You'd be surprised, though, I do have some facilities in New York, and then I have patients that are coming from California or from Alaska or wherever the case may be. It just really, truly depends. So in this case, again, for the physician portion of it, you've got to make sure that you have the understanding of the requirements, and then also making sure that you have a good contact of who are you going to go with to be able to get that information so that you can start that application. So one of the things that we have looked into that's a little bit different is I think that the majority of the time, physicians are a little bit hesitant about being part of a provider's list for Medicaid, especially for an out-of-state program. If, for example, they are a specialty doctor and they want to make sure that they stay within a certain program, right? They don't want to be part of this particular Medicaid or out-of-state. So one of the things that we do is we are actually doing the OPR application for the enrollment. And what that is that it's for the ordering, prescribing, and referring physicians that are listed on the claim. And it's a shortened version of the actual individual application. And what it does is it actually makes it so that these are just for services that have been rendered. You're able to get those claims paid. It's a much easier application. And I feel like that in this case, when we were able to get these applications in front of the physicians, it's a much easier conversation to be able to talk to them about it. Maybe have some sort of a letter, right, from either your legal department or someone that can really truly make them see the importance of being able to be enrolled for this particular service, especially if it's, I've seen certain accounts that have gone up to $8 million for an out-of-state claim. So we actually have $1 million all the claims all the time. They really truly add up. So it's just making sure that you have that information.